Is your thoracic outlet syndrome fake? Nervy and throbbing shoulder pain that is often diagnosed as thoracic outlet syndrome may actually be caused by trigger points. And after years of studying massage therapy, I have discovered that there are 4 muscles that can create TOS-like pain if they get trigger points, with the first one being the pec major. If you develop trigger points in the pec major, which is very common by the way, then there's a good chance you may experience the same kind of pain as thoracic outlet syndrome. This includes nervy and burning pain in the shoulder, inside arm, elbow, hands, and the 4th and 5th fingers. As such, trigger points can also feel like nervy pain. It's very easy for these two to get mixed up, which means if you have TOS pain, then try this out to see if this helps with any of your symptoms. Find the most tender spot within the pec major. Find a spot, simply hold static pressure there for 1 to 2 minutes. What you're doing here is paying attention to the pain you're feeling and seeing what it does. For example, some of you will begin to feel a pain in different areas shown on this image. Some of you will only feel pain where you're pressing it, and some of you may even feel your TOS pain. Regardless of where you're feeling it, if you're paying attention to your pain and it's either getting better or moving around, that's a good chance it's most likely a trigger point and a sign you should keep working on it. Now, a quick note, especially for the women when working on the pec major. Finding tender spots within the chest can become very scary thanks to breast cancer. And from my understanding, which is very limited by the way, so take this with a grain of salt, breast cancer usually develops in the fatty part of the breast and not the muscles where the trigger points are located. So theoretically, you should be able to move the fat tissue around a little bit in order to get underneath the muscles and check for trigger points. But with that said, please double check with your doctor to make sure there's no underlying issues besides tight muscles. Now, with all this talk about trigger points, you may be asking yourself, what the hell is a trigger point and why did this work? And the best way for me to explain this is for you to think of it like a mini muscle cramp. Whenever you have a muscle cramp, that muscle is going to end up contracting and tightening up. Well, a trigger point is essentially a mini muscle cramp that doesn't loosen up unless you actually work on it. And because it doesn't loosen up, it's going to continuously pull on the muscle fibers, which then creates tightness within the muscle. Now, going back to that muscle cramp, what's the first thing you're going to want to do when you get one?
You gotta put a little pressure on it. Put a little pressure on the calf.
The answer is to massage it out, which is what you just did by holding static pressure on the trigger points in the chest. Now, I know some of you are still asking, how can the pec major create pain all the way down to the pinky if it doesn't involve any nerves? And to understand this, let's first take a look at the other 2 muscles creating your fake TOS, which is the latissimus dorsi and the teres major. The lats are the big muscles opposite of the chest, while the teres major, also known as the mini lat, sits right behind it. Now, both of these muscles can create pain in the shoulder and down the arm, just like TOS when they develop trigger points. On top of that, trigger points can also limit your range of motion anytime you bring your arm up in front of you, because remember, they do make the muscles tighter. So how does both the lats and the chest create pain going down the arm if there's no nerve connection? And the answer has to do with fascia. If you didn't know, the muscle is surrounded by a thin connective tissue called fascia. And it's this fascia that helps connect the body together, and it does this with tension. These are known as the fascial lines. Now, there are about 12 fascial lines altogether, and each one helps connect the body in one way or another. But the one I want to focus on specifically is going to be the superficial front arm line. This fascial line runs from the chest and the lats into the front of the arm all the way into the hand. And since the fascia and the muscles act as one, if any of those bigger muscles get tight, like the lats or the pec major, then it can end up creating tension throughout the entire fascia line, resulting in burning and tingling pain anywhere that line is. This is how I believe we can feel pain in the pinkies and the hands from trigger points in the chest. The trigger points create tension not only in the muscles, but also the fascial lines. And since the muscle gets tight, so does the fascial line, which results in you feeling it all the way down in the pinky. Now, to release trigger points in the lats and the teres major, you can either perform some static pressure, or you can try another technique called micro movements, where you simply move back and forth and side to side on that one tender spot for 1 to 2 minutes. This will help relax the trigger point in the muscle and hopefully loosen the tension throughout the rest of the body. And by the way, these are all the muscles you're going to work on during week 3 for my 21-day TOS challenge. If you want to check that out, then I'll leave a link in the description below. Now, there is one more muscle that can create TOS-like pain if it gets full of trigger points, and that one muscle is the subscapularis. This is the front rotator cuff muscle, and if it gets tight and full of trigger points, it can create pain in the front and back of the shoulder, on the inside arm, and even on the back of the hand. And of course, it can also create limited mobility and pain similar to those with thoracic outlet syndrome. Now, this muscle isn't part of the superficial front line, but instead is part of the deep back arm line. And just like the front arm line, this one runs from the rhomboids to the rotator cuffs all the way into the back of the hand. Now, to release trigger points in the muscle, start off by bringing your arm up in front of you, which is called scapular protraction. This is going to help pull that scapula away from the rib cage, allowing you easier access into the subscapularis. From here, you have two different options. You can either reach across the body with your other hand and grab the scapula and the muscle, looking for the most tender spots. In this case, your thumb will be the one working on the muscle while your other fingers are grabbing the shoulder. Now, once you find a spot, go ahead and perform some static pressure or micro movements while also paying attention to the pain. The second option for working the subscap is to use the end of a broom to stick into the muscle, pretty much acting as a bigger thumb. Find the most tender spot once again and do the same techniques I just previously mentioned for 1 to 2 minutes. So what if you just worked on all these muscles and got rid of the trigger points, but you still have that tingly and nervy pain? Well, if that's your situation, then make sure to check out the video in the top right corner, because there I'm going to be showing you 5 different spots that will actually compress on your nerves and blood vessels. And of course, I'm going to show you how to loosen them up. I'll see you over there.